We all know women have a foot fetish. We love shoes, and cosmetic surgery is becoming as common as having a facial. So it was only a matter of time before we started having cosmetic surgery on our feet. You'd be amazed at what's being done out there.
Expensive shoes, expensive toes.
These days it's a bit more of a necessity, isn't it?
Oh, definitely, without a doubt.
When it comes to pampering our tired feet, most of us would just book in for a pedicure. Shops like this have made it even easier and cheaper. But the search for fabulous feet has just stepped up a notch, with some women going to even more extreme measures.
I've had a little bit too much. All of the people start to rush.
I've got the size for you. Oh, thank you so much. They're gorgeous.
Like many other women her age, 22-year-old Eloise Jacobs loves shoes. But finding the perfect fit hasn't been easy.
In certain shoes they cause me pain, and they would rub against the shoes and they would really actually hurt me.
Growing up, Eloise had what's called hammer toe, a deformity of the middle joint.
I definitely got teased by people at school. They all thought that my feet were not very, because they were basically bent over.
Fed up with being called hooky, plus the pain it was starting to cause, she decided to go under the knife.
So basically they took out a chunk of my bone, they put the metal pin through the toes, and that kind of fuses the bones back together, and that takes about 8 weeks, and then they remove the pins.
Another prick here.
Eloise is only one of a number of women who are turning to surgeons to correct typically troublesome complaints.
I think it's like anything that once the awareness is out there, we'll see more patients coming in.
For cosmetic surgeon Dr Michael Zacharia, toes are the new nose.
It's a bit adventurous to inject in the first place into the feet because most people don't think about doing so. But it's effective, it's simple, and not a painful procedure.
Kerry Carpenter is a receptionist at the About Face surgery. Today, she's a patient.
You won't feel too much pain because the skin is a lot thicker there.
She's been having Botox in her face for more than 8 years. Now she's getting it in her feet to stop them from sweating.
I'm going to the races, I have very sweaty feet, they slip out of my little strappy shoes, and I just want to be comfortable and not have that problem.
Podiatric surgeon Paul Bors is seeing more and more cases of, if the shoe doesn't fit, fix the foot.
Her toes were out to here.
He says with a growing trend for ever higher heels, operations to counteract their effects will become more common.
High heels, I love them, and if anyone asks me what I think of them, I say, look, they're nutritious, and they look at me startled, and they say, well, they put food on my plate. So this is the one we did, and this is the one that we haven't done.
Janet DaCosta has had a bunionectomy.
Oh, it looks much smoother. I mean, there's no question about it. The cosmetic result was pretty good. It looks like a normal, smooth foot without a bone sticking out.
Worth it?
Absolutely. I'm getting the next one done soon.
If we need to put some more in at a later date, we can without any problem at all.
For Eloise, the pursuit for perfect feet continues. She's trying out the latest treatment for women. The filler Juvederm is injected into the balls of the feet to plump the area and cure pain, so that high heels can be worn for longer.
I can, wear many, many more pairs of shoes. I love wearing sandals, I love wearing strappy shoes.
While shoe shopping is now much more fun for Eloise, her operation to straighten her toes was a grueling 3 hours long and cost her $3 grand. Her feet are still recovering, but she says it was a price worth paying.
It definitely was worth going through the surgery and the pain for what I have now. Oh, I absolutely adore them.
A woman. And there's more information on that story at our 9MSN website.